work stream under reframing the debate, build an arsenal of facts about government-run healthcare, recruit and mobilize allies, highlight horror stories of government-run systems. Use survey research to validate the perceived shortcomings of the single-payer system. Compile qualitative data and best-of research in probing with government-run healthcare systems, rationing, wait time, etc. Compile all materials into user-friendly formats for distribution. Identify free market allies like Healthcare America, the American Enterprise Institute, Heritage, Cato, Pacific Research Institute, Galen, etc., who will have a vested interest in critiquing single-payer healthcare. Identify unlikely allies, medical specialty organizations, patient groups, and others that may oppose government health care. Conduct aggressive national and regional media outreach to ensure that allies are inserted into the coverage around the policy debate so that an alternative view is represented in the articles. Create an ad that would show Democrats that likely response to show the likely response to a single-payer proposal. Float the ad on the internet and encourage conservatives to donate money to the allied organizations to support running the ad. Produce vignettes featuring victims of single-payer systems, distributed on websites via conservative bloggers and YouTube. Bring victims of single-payer systems to the U.S. for a media tour. Interview doctors who work in clinics on the U.S.-Canada border about why Canadians come to the U.S. for care. Seek opportunities to tell the single-payer story with national media, like the Wall Street Journal and John Stossel. And it goes on and on and on. I'm telling you this story because I just want you guys to understand that you may not think that people are paying attention to what you're doing here in this Capitol, but they are paying close attention. If you think that they went to all this trouble to discredit a movie, and they were very quiet about this. That's why all these meetings were held in secret, and that's why there were. And I happen to have this because someone gave me a printed copy of this, it was held in secret because the industry did not want anyone to know that it was in any way involved in the campaign to discredit Sicko. It has long been opposed to single payer, obviously, for obvious reasons. We heard over the debate on healthcare reform in 2009 and 2010 in Washington that what Congress was attempting to do then was a government takeover of the healthcare system. They were behind the scenes working to create or to shape that legislation, and they were very successful in doing that. They are very, very successful when they set their minds to do something. So I'm telling you that story once again just to make sure that it's abundantly clear that you may think that what's going on right now is not being noticed by the rest of the country, and certainly not the insurance industry is not paying a lot of attention, but I can assure you that somewhere, probably as I speak, they're probably even monitoring what I'm having to say right now, that they have already developed probably a much more comprehensive plan than this one to try to derail what's going on here in Montpelier. I have no doubt about it. They do not want you to succeed. They will be pulling out all the stops, and you will not even be aware that they're behind it, because that's the way they operate. They want to make sure that it's perceived that there's a grassroots movement that will be developing in Vermont to oppose the efforts by lawmakers who are in favor of a single-payer plan. I will tell you that I had to be a part of this. I had to play a role in discrediting the movie because CIGNA certainly was depicted in the movie in a number of vignettes. Soon after this meeting took place, APCO and AHIP sent to all of us who were in that meeting, all the heads of communications, this binder. And this is a binder that has 7 different tabs in it. You can see how much money, how much time and attention they went to this to help us to be able to talk about the evils of single-payer, evils of government healthcare systems. Under the first tab are general talking points. So the second tab, briefings on government-run healthcare. What's wrong with government-run healthcare systems? Patients endure prolonged and harmful waits. Patients are subject to ration care and substandard medical equipment. Patients often receive poor quality care. The cost of implementing a government-run healthcare system in the United States. And again, it goes on and on. This was our Bible. This was what we were supposed to be using when reporters called us with any questions about the movie, so that we would have at our fingertips, a book that we could refer to. These guys don't let anything, leave anything to chance. They want to make sure that everyone is literally working off the same page. And that's what's going on right now, somewhere in Washington, or somewhere in Philadelphia, some boardroom or conference room. We had other meetings, and then as soon as the movie did indeed start screening in the United States, we were getting daily monitoring reports, even to the point of knowing how many people were seeing the movie. And we were sent clips every morning of all the media coverage that had appeared anywhere in the country, including wherever the industry was able to get someone to write a letter to the editor or place an op-ed in a local paper. Again, this was all being orchestrated by the insurance industry, but no one knew it. No one knew it at all until I wrote that in my book. I have a chapter in the book called The Campaign Against Sicko.